Good afternoon, everyone. My name is Tim Myers with Prairie Rehab, occupational therapist. Today the topic is get a grip on your shoulder pain. I've been with Prairie Rehab now for about 9 years and I'm working with orthopedic outpatient patients. So today we're going to start with the rotator cuff, a basic anatomy of the rotator cuff to kind of understand what that is. So this would be the shoulder blade if I'm looking at the back right shoulder, and I'll have Morgan come up here. I'm going to step to the other side. So just so you can get a reference on this, here's the shoulder blade. We're looking at the back right side. The rotator cuff is 4 muscles that surround this bone here, more specifically the head of it. And imagine that the head of it is a golf ball that sits on a tee. So the rotator cuff surrounds the golf ball to stabilize it on a tee, preventing it from dislocation. So we have the muscle up top, here's 2, 3, and then if I were to have her turn around on the front here, if I were to turn like this, I'm going to have you come to the other side here. There we go. Now we're looking at the front. So I'm going to move her here just a little bit. Here's her collarbone, the clavicle right through here, and the 4th rotator cuff muscle sits right here. And again, you can see they all surround the head of this bone to stabilize it. Okay. This muscle, if I have you turn around again, right up here, this rotator cuff muscle called the supraspinatus goes underneath this bone here and comes out here. And what it does is it lifts, or helps initiate lifting your arm out to the side. And it's the most susceptible rotator cuff muscle to become torn because of its anatomical position and the mechanical abrasion that can happen, basically the friction when the space between here and the rotator cuff muscle becomes narrowed. Thank you. If you have any questions at any time, please put them in the comment section and we will answer those for you. I want to talk a little bit about tears briefly, so people hear about, well, I have a rotator cuff tear. There's a partial tear, and that means that the tendon is damaged but not completely severed. So if we look at this example again, I'm looking at the back of the right shoulder. The red is muscle, and muscle turns into tendon, and tendon attaches to the bone, just so you have an idea. Where ligaments attach bone to bone. So again, a partial tear is the tendon is damaged but not completely severed. A complete tear, the soft tissue is torn into 2 separate pieces. And then a full thickness tear is when the tendon, again that's the piece of material that attaches to the bone, is completely torn off the bone. And so typically if you have a full thickness tear, depending on which muscle it is, it may require surgery. Where more often a partial tear, you can have therapy for that. Now let's talk about tendinitis and tendinosis. So tendinitis refers to, the itis refers to inflammation of the tendon. So again, inflammation of the tendon. Tendinitis is typically an acute injury. It's more common in people that are older than 40, that have decreased elasticity, basically thinking of about a rubber band that doesn't stretch as much, so they're more susceptible to tears, and decreased activity tolerance or the ability to tolerate stress or load on the tendon. Some things to help with tendinitis would be rest, ice, anti-inflammatories, and avoiding the motion that is causing the discomfort. Typically tendinitis lasts 4 to 6 weeks, where tendinosis, and I don't want to confuse the two, is more chronic. Typically, there's no inflammation with tendinosis, and it's more of a chronic injury that lasts 3 to 6 months. Basically, the person can sometimes continue to do the same thing, and it never allows that tissue to heal, so it becomes more of a chronic issue versus an acute issue. Again, acute is tendinitis, and the more the chronic issue is going to be the tendinosis. And one of the reasons why they take a long time to heal is because they have decreased blood supply. The next thing I want to talk about, some of the common shoulder diagnoses that we see, which would be shoulder impingement. There is, if I'm looking at this again, I'm just going to pull this up a little bit here. If I'm looking at the shoulder, can I have you come up here, Morgan, again? I'm going to turn to the side. The bone out here is this bone here called your acromion. Again, the rotator cuff, one of the four, goes underneath that acromion. But the space, and then it pops out over here. So the muscle's here, it goes underneath the bone, and pops out here. But the space is narrowed in there, which then creates a friction, and that's shoulder impingement. Typically, thank you. Typically, shoulder impingement, there is an impingement zone. It happens between about 60 and 120 degrees of shoulder elevation. So this typically is where it's going to happen if you get the discomfort. A lot of people have discomfort out here, and it might radiate down to about right here. And a lot of times that can be shoulder impingement. So who's susceptible to that? Overhead athletes, swimmers, painters, people that do a lot of elevated work repetitively or static overhead activity, people that have poor postural deficits. So as we get older, we tend to get hunched, that forward head positioning, our pecs get tight, and that area I talked about before out here, that space becomes narrow, causing that discomfort. And then again, people that do repetitive overuse injuries or jobs are more susceptible to that. The next thing I want to talk about is frozen shoulder and what that is. When the connective tissue, the joint capsule, and I'll explain this in more detail here in a second, becomes thick, stiff, and then limits mobility. So if I have Morgan come up here again, and you turn to the side here, Morgan, there you go. So there's one bone that goes from your elbow to your shoulder, kind of looks like my forearm, and on top here, that's the golf ball. So that's the head of the humerus that sits on a tee, okay? And there's ligaments that connect the golf ball to the tee to stabilize it on the tee. But what happens, thank you, what happens is that those ligaments become inflamed and stiff, which then decreases your mobility. That's what frozen shoulder is. The cause is unknown, but what research has found so far is that people that may be at more risk for it have cardiovascular issues, hyper or hypothyroidism, tuberculosis, Parkinson's, diabetes, and also people that have had surgery, say like a mastectomy, or someone that has had a stroke, where you cannot move your arm for several weeks, several months, and then there also could be more susceptible to the frozen shoulder. Typically females in the age of 40 are more susceptible, and if you have frozen shoulder on one side, you can also get it on the other side. It's typically 1 to 3 years in duration. Depending on what research you look at, there is 3 to 4 different stages of frozen shoulder. There's a freezing phase, which is that's the first phase, which is when you have pain with any movement. Range of motion starts to become limited, and one of the key things is you have increased pain at night. That's with the freezing stage. The second stage Now, the freezing stage, I'm going to back up, I'm sorry, just for a second, can last a couple months, it can last 4 months, it can last 5 months. But those are the things we look at to see what stage are you in. The frozen stage, which is the second stage, pain begins to diminish, but stiffness increases, and you have decreased mobility and decreased function. And then the last phase, which is the thawing, range of motion begins to improve. So one of the things that PTs and OTs do is they can assess what stage are you in with frozen shoulder, and then we can determine what program, home exercise program, is best for you at that time to maintain your function and mobility. Some of the treatment options are range of motion exercises. Some people use what's called a TENS unit for pain. Depending on what stage you're in, it might be moist heat with that. So the next thing is we're just going to briefly talk about some signs and symptoms of shoulder injuries. The first one would be pain, decreased mobility, popping or clicking sensation. So sometimes people come in and they say, hey Tim, when I do this, I get a popping, clicking sensation in my shoulder. It's also known as crepitus. And that's a sign or symptom of a shoulder injury, a stiffness in the joint or in the muscle, and then lacking strength. So those are all signs and symptoms of a shoulder injury. So what are some of the preventions of shoulder injury? So what are some of the things we can do? So exercise, strengthening, and range of motion exercises. The first one I want to talk about would be a scapular clock. Basically, if you're sitting or standing, you would shrug and then do the opposite, push your shoulder blades down, relax, and then squeeze them together, and then bring them forward. So you're pushing your spine back and rounding your shoulder blades. Again, I'll go a little bit quicker with that. Shrug, push down, relax, squeeze together, and do the opposite coming forward. That's a scapular clock. The next thing we can do is shoulder circles. And so we can do small circles like this and make them a little bit larger, and then we can reverse that. Now, I typically don't do it up here because before we talked about people that have shoulder impingement, and that's when that space in here becomes narrowed and it pinches. So we don't want to be up here. Remember that's 60 to 120 degrees. So anywhere from about here to here can be very painful if people have impingement. So we're better off being down here, typically, not all the time with that. Shoulder retraction, so shoulder blade squeezes. Some people like to be in this position. And so what I'm doing when I'm pulling back is I'm stretching out the pecs and I'm strengthening the back muscles to get me in a better position like this versus the hunched position. Some people like this position, squeezing their shoulder blades back like this. Again, we're stretching the pecs in the front and strengthening the back side to help with our posture. Internal, external rotation of the shoulders, which would be like this. You can do it with your elbows at your side. Or we can go up to about 30 degrees out to the side and work this. Just like that. Okay? Cervical range of motion, so neck range of motion. Very straightforward would be coming down and going back. Okay. Turning to one side and then the other. And then side bending, one ear to that side of the shoulder and then the other side. Like that. And pec stretching. So I'm going to bring Morgan in on this one to show you a couple different ways to stretch your pectoral muscles. So some of you have probably seen a foam roller. This is a 36-inch in length foam roller. It's the full circumference. There are halves too. Sometimes people, if they don't want to pay for one, will roll up beach towels or use a pool noodle and wrap a beach towel around that to get their circumference. So what I'm going to have Morgan do is she will sit on here and lay down. So you want your butt supported, and if you move down just a little bit, and then for your head to be supported. So the first one, you can see that if the foam roll is right here, it's automatically going to stretch out her pectoral muscles. They're going to drop down. But in addition to that, she can squeeze her shoulder blades together to get more of a stretch here. Again, we're doing this exercise because most of us, not all of us, do work in front of us. So we either sit at a desk or we do construction work. So a lot of times the front gets tight, the pectoral muscles, and we start to get that rounded position. So we're trying to open up that chest to help with our posture. So that's the first one. The second one is if she brings both her arms up like this, palms facing each other, and she bends her elbows as she comes down, and then opens them up. She's going into the letter T per se. And now she wants to feel a stretch on her bicep and in through her pec. You do not want to feel discomfort up on top, right up here, going down, or on the back side of the shoulder. So it's going to be through the pec and the biceps. So the biceps through here and the pec muscle through here. And then when you come back up, I just simply bend your elbows back in and then come back up. And then the last one is if you start with your arms crossed, and then she would open up like the letter Y or the letter V. Maybe hold for a few seconds and then come back down. And we'll have to do two more like that. And then it's opening up again like the letter V. Same place, same area where we should feel that stretch, right on that front side through the bicep and the pectoral muscle. Good. Thank you. So again, this is a foam roller, 36 inch, because we want you to be able to, if you do use this, to be able to have your butt and your head supported. Because there are other foam rollers out there that are shorter, that are used for different things other than the 36 inch foam roller. Okay, so the next one for your pec is we could use a doorway, and in this circumstance here, I'm going to use the cupboard. And if I want to stretch out my right pectoral, I'm going to stand in this position, and then what I'm going to do is slowly turn my torso and head the opposite direction. I don't want to let my head get in front of my torso in the midline. And I want to feel it stretch through the bicep and the pec again. Now, if I'm feeling it up on top here, which I don't want to, I may need to raise or lower my arm so I get the stretch through here, okay? The other one that we could do, some people like, is if you use a corner of your wall, stagger your feet, put your arms up on a wall like so, and just gently lean in to the wall, again, to get the stretch through the pec. One of the biggest things when you do this is make sure you're not getting discomfort out here. That's going down on the side or the back. You want to stretch all through here. So again, why are we doing that? Because we get this posture here, which then brings everything forward, which then can narrow the space in our shoulder, which can lead to shoulder pain. It can start to cause pain up in the front of the shoulder, so we want to get back to our correct posture. So talking about posture, I have Morgan. One thing you can do is wear a postural shirt. You can get them online, you can get them at Shields, there's Amazon, and I'll have Morgan come up here if you face the camera. This specific one here is a zip-up postural shirt, and you want them to be very snug. And if she turns around and we move her hair, you can see that there's lacing in this postural shirt, which makes her have her shoulders back in good, nice, upright posture. So that's what a postural shirt is. There's going to be several brands, different types. This is just one. Again, you can get those at Shields, Amazon, different places. Thank you. The other thing for posture is there's postural bras out there. There's other devices you probably seen on TV that have a strapping system. You can also try those, whatever works best for you. Core strength is a big one for your posture, working on that. And breathing techniques, believe it or not, can be a big thing for your posture. I want to talk about kinesio tape for your posture. So I have a few pieces here. The kinesio tape, there's different sizes, meaning the width of it. So this is just one. There's different colors too. We've got the brown one in particular here. But what I'm going to have is I'm going to have Morgan come up here. And let's have you turn, Morgan. There you go. Okay. So one thing that the kinesio tape does is it initiates muscle. So it can help with your posture. It'll put you in a certain position and it can initiate the muscle to work. And so if we're talking about posture, if we come underneath this bone right here, on the front side of the shoulder, what we could do in clinic, or sometimes people do this at home, you know, if she was hunched like this, I would want to make sure that her shoulder blade is back and together, a little bit of gentle shoulder blade squeeze. I would take this tape, and it just, you can peel it here, and this white piece comes off, and then there's the adhesive on here. And then once I have her in the right position, I would come across, so I would turn to the right, come across here. I want a little bit longer, and then I would apply the tape there. Now, depending on the person and the posture, and this is where the PT or OT can help you, is how much stretch do you do to the tape? Do we do 25% pull, 30% pull, and we will help you with that. So that's one way to help with your posture right there. Now, some people have allergies to adhesives, so be aware of that. So some people do react to the adhesives with this. Another one is on, here's your shoulder blade 1, shoulder blade 2, is if I were to tear the middle of this backing on the tape, I could pull this apart, stretch it, and lay it across here, like so, which then would squeeze her shoulder blades back together. That's the second option. And if I have her turn to the left, another option is, here's the collarbone right here. If we come below that, once you have that person in a good posture, because if she's like this and rounded, we want her back like this, is we can put that tape here, and you come over the top of the shoulder, and that's going to help put her back like this versus being forward and rounded. So those are 3 different ways to do a taping for posture. Thank you. Good body mechanics. So always keep close to your body when you're lifting. It seems pretty obvious to a lot of people, but every inch you go out from your center of gravity while you're lifting puts a lot more pressure on your spinal cord and column. You'll see a lot of guys that might be lifting and walking, but they're going to try to step over something and they go out like this. So you always, if you can, keep the load close to your body. One thing you want to avoid if possible are static positions. So you see a lot of people using drills where they may be up here like this, where they could simply be on a ladder and be like this. That's another thing that you could do to help with that. And then also ergonomics, which I want to talk a little bit more about next time. That'll be next. We're going to do ergonomics next Thursday at 1 p.m. with that. Other ways to help would be just to rest it, ice or heat, whichever works best for you. Stretching, anti-inflammatories, NPT and OT, and just remember safe lifting techniques. So appreciate you being a part of this Facebook Live. I hope you learned a little information, and then leave any comments in the section and we'll try to answer them for you. Thank you.